So good morning, everyone. Good afternoon. Welcome to the Global Network webinars. My name is Alexander Loschke, and I work for the United Nations Statistics Division here in New York, and I will be moderating this webinar together with my colleague Panya Yu. Today, we are delighted to welcome Stefania Di Giuseppe and Kwame Osei, both from the Food and Agriculture Organization of the United Nations, and Jessica Heckert from the International Food Policy Research Institute. They will present on the topic of measuring women's empowerment and nutrition in large-scale surveys. In many low and middle-income countries, inequalities and poor diets jeopardize women's well-being. Empowering women and guaranteeing them an adequate diet is both a moral obligation and a critical driver of economic growth, social stability, and innovation. In 2015, FAO developed and launched the Minimum Dietary Diversity for Women, a simple tool that measures women's diets and identifies population groups at risk of malnutrition. In addition, FAO is currently contributing to the adoption of the Women's Empowerment Metric for National Statistical Systems, a tool developed by the International Food Policy Research Center, Emory University, Oxford University, and the World Bank to measure women's empowerment across both agricultural and non-agricultural livelihoods. The Minimum Dietary Diversity for Women and the Women's Empowerment Metric for National Statistical Systems are designed as lean instruments that can be integrated into large-scale household and agricultural surveys. And this webinar will present an overview of the development of the metrics of the two tools and describe the effort made by FAO and partner countries for integrating them into agricultural surveys, sharing experiences, successes, lessons learned, and proposed steps forward. So let me now introduce our speakers. So we have with us today Stefania Di Giuseppe, who is an econometrician at the FAO Statistics Division. She has extensive experience in gender-responsive policy design, socio-economic analysis, and food security in crisis and fragile contexts. Her work focuses on bridging data gaps, applying advanced econometric methods to large-scale surveys, and translating evidence into actionable policy recommendations to promote gender equality, food security, and resilient agri-food systems. We also have a presentation by Kwame Osei, who is a senior nutrition and food systems officer at FAO. Unfortunately, he is unable to join us in person today, but he will present through a pre-recorded video. And we have with us Jessica Heckert, who is a senior research fellow at the International Food Policy Research Institute. And as part of her research program, she focuses on gender and youth, develops women's empowerment metrics, and uses them to study the impact of development programs as well as the links between empowerment and other outcomes. And before I hand over to the first speaker, just a few reminders. This event is about an hour long. Our speakers will present for about 35 minutes, and we will have a Q&A session at the end. Throughout the presentation, please feel free to write your comments and questions into the chat box at any time. And then during the Q&A session, we encourage you to ask the question yourself by using the raise your hand function. Or if you wish, we can also read out the question for you. This Global Network webinar is being recorded and will be made available on the global network of data officers and statisticians, and we invite you to continue the discussions there after the webinar. And with that, let me now turn over to our first speaker, to Jessica. Please, Jessica, the floor is yours. Thank you.
Good morning, good afternoon, everyone. Thank you for joining us. You'll just give me a second while I get my slides going. So first of all, this work on developing the women's empowerment metric for National Statistical Systems has been a collaborative effort with the International Food Policy Research Institute, the World Bank LSMS team, Emory University, and Oxford University, as well as partners in each of the country where we developed pilots. And so in Bangladesh, a group called Data, in Guatemala, Vox Latina, the Malawi National Statistical Office, and then interdisciplinary analysts in Nepal. So first of all, why are we interested in measuring empowerment? In a review of projects that explicitly aim to empower women, we determined that they could classify their strategies into three categories: reach, benefit, and empower. And those that reached women, they visited them, held activities with them when they were convenient. And those that benefited women led to tangible improvements in their welfare, for example, by increasing incomes or improving their nutritional status. All of these things are important, but they're not empowerment. So the projects that empowered women, those were the ones that specifically aimed to empower women, for example, by helping them make strategic life choices or encourage their input into decisions. There are a wide variety of indicators for both reach and empowerment. There are fewer indicators available, there are a wide variety of indicators for reach and benefit, and there are fewer indicators available for empowerment specifically. So that's what motivated our work in this specific area. So why do we want to measure empowerment? Metrics matter if they can motivate, monitor, and shape policy. If we want a policy agenda that prioritizes women's empowerment, we have to measure it. The elevation of women's empowerment and gender equality as sustainable development goals recognizes that there's an intrinsic value to measuring empowerment as an outcome, and it also means that, and also notes that there's value in measuring and understanding empowerment because it is a pathway and a means to achieving other important objectives. So what is WEMNS? So first of all, WEMNS is a survey-based and direct measure where we interview both women and men to be able to quantify their empowerment. It is short. As we interviewed key stakeholders, we identified that a 15-minute module was sort of the limit that we were aiming for multi-topic nationally representative surveys. Indeed, WEMNS ends up being a bit shorter in that, so that's great. WEMNS is aligned with the Sustainable Development Goals. First, Sustainable SDG 5 on women's empowerment and gender equality, as well as other relevant SDG targets that fall into other goals. It's also counting-based and decomposable, and there's the ability to compare across subpopulations. So the methodology that we use is directly analogous to multidimensional poverty indices, but instead of measuring poverty, we measure empowerment. And so that same methodology has a lot of benefits in being able to compare across different populations. So I'm going to tell you a little bit about our process of developing WEMNS. We started this journey almost 6 years ago, and we began with a process of stakeholder consultations, review of SDG indicators and targets, development of a draft questionnaire, and then we conducted a workshop to discuss questionnaires with stakeholders, and then we identified our pilot countries, which are our first phase of pilot countries were Bangladesh, Malawi, and Nepal. We then conducted cognitive interviewing and piloted the questionnaire so cognitive interviewing is a qualitative method to understand the what parts of the question are well understood and which ones aren't, and how to improve those questions. So that led us to a process of refining the questionnaire and responses. We had 2 waves of phone surveys in Bangladesh, Malawi, and Nepal, and then we were able to add Guatemala as an additional pilot country. And we did 1 wave of phone surveys in Guatemala. We conducted psychometric analysis to look at things like internal reliability, and we did that in between the 2 rounds of phone surveys so that we could, again, improve between phone survey 1 and phone survey 2. We then further revised the questionnaire and moved to a phase of face-to-face surveys in 2022 and 2023. We conducted further psychometric validation. We went through a process of index and indicator construction, and then we launched WEMNS as a metric and as a tool in February 2024. Over the past year and a half, we've been collaborating with FAO in a process of integrating WEMNS into national agricultural surveys in Liberia, Sierra Leone, and Tanzania. In December, we're going to have a lessons learned in scaling workshop as part of a process of further expanding WEMNS into other countries. And then in 2026, when we have data from more countries, we are going to also revisit the index construction and specific cutoffs and see if those need revision based on the larger sample size available. So what is our conceptual justification for WEMNS? So first of all, we think of empowerment as 4 domains: intrinsic agency, collective agency, instrumental agency, and an agency enabling resources. So the area of agency that you're probably most familiar with is instrumental agency, which we think of as power 2. This is the ability to make important household decisions, and it's probably, it's the most common way we aim to measure empowerment. In WEMNS, we expand instrumental agency to also include choices about time allocation, and we call this time use agency. Another component of agency is intrinsic agency. So this is the power within. And it is the idea of critical consciousness and awareness of inequalities. So essentially, this is an early building block when we think of empowerment. So it includes critical reflection that allows individuals to become aware of their ability to make choices and to change their lives. On the right-hand side, we now have collective agency, and this can be described as power with. So it's a critical component of women's empowerment beyond the household. It's the idea of people coming together in order to have more agency as a group. There have been a lot of investments in group-based development approaches over the past decade or more, and so and ways to measure collective agency, there were underdeveloped. So we made some substantial improvements towards measuring collective agency in WEMNS. And then we consider, on the bottom right-hand side here, agency enabling resources. These are the material, human, and social resources that enhance individuals' ability to exercise choice. So things like access to land, access to information and communication technologies, access to credit and banking possibilities. So here are the women's component indicators here laid out in a similar format to the previous slide. Under intrinsic agency, we have endorsement of women's freedom and livelihood choices, endorsement of women's freedom and family formation choices, and rejection of women's subjugation to sexual harassment. So importantly, these intrinsic agency indicators are only measured for women. The rest of them are all measured for men and women. We have instrumental agency, which includes influence over time allocation, influence in spending decisions, and influence in own health decisions. We have collective agency, which includes participation in organizations, leadership in organizations, support for women's and men's community engagement, and agency enabling resources, which is use of information and communication technologies, use of financial services and access to credit, and secure property rights. And the estimated time for implementation, this is actually needs to be updated in this slide, sorry. We were actually we're more in the 12 to 13 minute range. In some of the early pilots, it took a bit longer. So how does WEMNS measure empowerment? So the 12 indicators for women and 9 indicators for men are all equally weighted. We then use a dual cutoff counting methodology, where we first identify individuals as constrained or unconstrained in each indicator based on a cutoff. We then identify respondents as empowered if they are unconstrained on at least 70% of these indicators. And again, this process is directly analogous to multidimensional poverty indices. So just as an example, I am going to show you a snapshot of results from our Malawi pilot survey. And I have a few slides of different results that you can get out of WEMNS. In Malawi, we found, for example, that 81% of women are disempowered, while only 62% of men are disempowered using the overall indicator. And disempowered women are constrained on an average of 53% of the weighted indicators, and there was an overall women's score of 0.57. Among men, disempowered men are constrained on an average of 48% of the weighted indicators, so they're constrained in fewer areas, and there was an overall women's score of 70. 0.7. WEMNS can also be used to show how different indicators contribute to disempowerment. This figure shows the depth of empowerment, as well as how much each indicator contributes to the depth of empowerment. The depth of empowerment being the length of the bar here. And here we're comparing women across all 4 pilot countries. Key findings that we see emerging here, the following areas contribute most to women's disempowerment, and those are the ones with the largest bars. And those domains are lack of confidence in women's community engagement, which is here in the dark purple, leadership and organizations, and that's that middle shade of purple, and then influence in spending decisions, which is this middle shade of orange here. So those are some of the largest contributors across all 4 countries. This same methodology here can be used to compare, women in different regions of a country or key social groups within a country, for example. So just in conclusion, we have all of the materials related to the use of WEMNS and introducing them, using it in various ways available on the WEA Resource Center, which you can access through this QR code or directly through this website here. And you can always reach out to us for technical support as well. Thank you very much for joining us, and I'll hand things over to Stefania.
Thank you, Jessica. I believe we will now see the video with the video recording of our colleague Osei. So, Panya, if you can put the video on, that would be great.
Good morning, good evening, everyone. My name is Kwame Osei, and I work with FAO in the Food and Nutrition Division in Rome as the Senior Food Systems and Nutrition Officer. And I am pleased to join you today in this webinar to present the new SDG2 indicator, which is the minimum dietary diversity for women. And then also there is another for children that I will talk about. In this presentation, I will share with you mainly what the indicator is about, how it's computed and interpreted, and then share a bit about our work as FAO around this indicator. So first of all, what is the minimum dietary diversity indicator? It is a simple population level indicator for assessing the diversity of the diets of women and children, and I'll go into details of that through simple count of food groups consumed in the past 24 hours. So the indicator that was approved last March by the UN Statistical Commission as a new SDG indicator on diet diversity was one indicator with two sub-components. And this indicator is under SDG 2, specifically under number 2.2.4 A and B. The subcomponent A, which is the minimum diet diversity for children, focus on capturing the diversity of diet consumed by children aged 6 to 23 months. The next subcomponent, which is the minimum diet diversity for women, focus on capturing the diversity of diets of women aged 15 to 49 years. So those are the two main groups or population groups on for whom this indicator targets. So the next thing is um, what is diversity of diets? And I would like to approach answering this question by looking at healthy diet in general, because diversity is a component of healthy diet. So what constitutes a healthy diet? A few years ago, there was FAO and WHO joint statement that was released, which describes what a healthy diet consists of. And there are four principles that this document underscores for a healthy diet. First is that a healthy diet needs to be adequate. Adequate in the sense that it needs to provide nutrients to meet the nutrient requirements of the person or the population consuming it without providing excess. The second principle is that it needs to be balanced. And here, balance means the energy sources within the food, particularly the protein, the carbohydrate, and fats, needs to be balanced in terms of proportion for a healthy diet. And there is a WHO guidance on that. The diet also needs to be diverse. Diverse in the sense that it needs to consist of different kinds of foods and food groups for it to be healthy. And then also it needs to be moderate in the sense that it has to limit the intake of foods that we know consuming a lot can lead to negative health consequences. For instance, salt, saturated fats, and others. And above all, we should also note that for a food to be healthy, it needs to be safe. So food safety is a very important component also to consider. On this slide, I describe what constitutes the minimum diet diversity. Starting first with the women, and the next slide I will talk about that of children. So a woman aged 15 to 49 years, and I'm stressing on the age range, is said to have achieved minimum diet diversity if they consumed 5 or more of 10 predefined food groups. And these predefined food groups are in the table here on the slide. I won't go into details of that, but it consists of grains, pulses, animal source food, dairy, and others. So consuming 5 or more of these food groups in the past 24 hours makes a woman aged 15 to 49 years meet the minimum diet diversity threshold. On this slide, I want to emphasize that collecting data and the earlier parts also of the analysis of the minimum diet diversity indicator are done at individual level, as I was talking, I spoke about women aged 15 to 49 years, children 6 to 23 months meeting the indicator, the threshold. But the interpretation of the indicator for the SDG monitoring, for policy purposes, for programs, is done at population level. So not at an individual level, but at population level. So the first indicator or metric that can be obtained from a data set that collected information on the minimum diversity for women or children is the one that is used in the SDG. That is the threshold of if they consumed 5 or more food groups. It's one key indicator. And that is a binary indicator where a child or a woman achieved it or not. But this interpretation, we talk about the proportion of women within a particular population that met the minimum dietary diversity. That is what how it's interpreted, or what makes policy and program sense. And then the same thing with children. For another indicator that can be obtained out of a data set that collected information on diversity are the food groups, the proportion of individuals consuming each specific food group. Remember, I made mention of 10 predefined food groups for women and 8 predefined food groups for children. So for each food group, you can compute the proportion of individuals within a population that consume that particular food group. And here, even though our focus in this presentation are women and children, other population groups, you can also compute the proportion of food groups consumed by, say, men, if you have the data. It's only the threshold, consuming 5 or more food groups, that has not been validated in other population groups. It's only validated for women aged 15 to 49 years and children 6 to 23 months. A third metric that you can get of such a data set is the continuous variable, which is the food group diversity score, which for women, because we have 10 food groups, you can get a diversity score that range from 0 to 10. And for children, you can get diversity score that range from 0 to 8. So those are the 3 key matrices that you can get from such data set. And these are explained at population level. So what are the key attributes of the minimum diet diversity indicator? And sometimes we get a question, the SDGs were endorsed or adopted in 2015. Why is it that it's only in 2025 that we have an indicator for measuring diet of what people consume under the SDG? And this is because the existing indicators before validating the minimum diet diversity indicator, those existing indicators that we call reference indicators or measures are quite cumbersome to implement at the field level. An example is the 24-hour recall, the weight food records. Those you require to collect quantities, sorry, of food consumed by the individuals participating in the survey. And sometimes it requires extensive enumerator training most often, and you need to at times go with equipment to the field where you can estimate the quantities of food consumed and all that. The MDD-W or MDDC indicator doesn't require data collection that collects quantities of food consumed. It's only a yes or no answer if the food was consumed or not. And so it makes it easy to implement at the field such surveys collecting the minimum diet diversity information. It is less time consuming. It is less costly because it's simple. It requires minimal skills in terms of enumerator training and others to collect that information. And because of this simplicity and feasibility, it's easy to implement this survey tool frequently and also on a large scale. So that gives it provides a very good avenue for obtaining at least some component of dietary information of populations to understand what populations are eating, in particular the diversity of their food groups. their food, which is a key component of healthy diet. How is the data collected? There are two main ways of collecting data for computing minimum diet diversity, and two main questionnaires for that regard. There is the open recall method, where the enumerator sits with the survey participant, which being the woman of reproductive age or the woman age 15 to 49 years, or being the caretaker of the child 6 to 23 months, and ask them to recall all the food that they consumed in the past 24 hours before the survey. And here they record just the names of the food without the quantities. And then the enumerator can now put those foods under the various food groups to classify them into the different food groups. And here, let me say that it doesn't necessarily collect quantities from the survey participant, but for a food to be considered under the food group of the minimum diet diversity indicator, the food needs to be consumed in amounts more than 15 grams. In the past 24 hours. At the point of its consumption, more than 15 grams should be consumed. Otherwise, it's not counted. And the way in surveys we do this is that we don't collect the quantities per se from the individual, but you use contextual knowledge, also talking to nutritionists and others at the beginning of the survey design to understand which foods are more likely going to be consumed in lower quantities, like condiments and others, and then you class them. So when they come up, those can be categorized as not consumed in large amounts. And then we have the list-based questionnaire, which you already have the predefined food groups with the specific food items under each food group, and examples of specific food items under each food group. And the enumerator reads this out to the survey respondent. And if the respondent says that was consumed, it's a yes. If it wasn't consumed, it's a no. So those are the two main approaches for collecting such information. And as FAO, we have a guidance manual on the FAO website. The website is provided on this slide, which provide detailed information on how the minimum diet diversity for women can be collected, constructed, and also interpreted. There is also other documents like frequently asked questions with answers to those questions on our website. And then also there is an e-learning course that one can take to learn more about the indicator. So the web link is on this slide. Finally, what did we do to support the Women Empowerment in Nutrition survey? We facilitated the development of the food list and the survey models. We supported that. And then also the enumerator manual, and in terms of enumerator training for the minimum diet diversity for women, the data collection, and develop the expertise of the survey team on the data analysis and reporting. And I must conclude by saying that we are available to provide technical support on this indicator, and we want to encourage every avenue for including the indicator into surveys. The models for collecting data on the indicator into surveys, so that we can have more data coming up to facilitate the reporting on this SDG indicator. Thank you very much.
So this was the recorded presentation of our colleague Osei, and we will now continue with the presentation of Stefania Di Giuseppe. So
Yes.
Stefania, if you could please share your screen. And
can you see it?
Not yet.
Okay. I knew it.
No worries. We'll get there.
Okay. Now
So
I think.
Yeah, put it in presentation mode, and I think then we're good to go.
Okay.
Okay, switch the screens.
Okay.
Yeah, brilliant. Okay, go ahead.
Thank you, and thanks everybody for being here today. So with this presentation, I will be walking you through how we integrated the women's empowerment and nutrition, what we have been calling the WEN approach, into agricultural survey under the 50 by 2030 initiative. Let me draw you quickly into the background. The 50 by 2030 initiative to close the agricultural data gap is a partnership between FAO and the World Bank. We have been supporting so far 27 countries, mostly in Africa, in strengthening their agricultural and rural statistics. Within this effort, FAO worked with IFPRI to integrate the women's empowerment metrics alongside a women's dietary diversity module supported by the FAO Nutrition Division. These tools were piloted in 3 countries, Liberia, Sierra Leone, and Tanzania. And the goal was simple but yet ambitious: to provide countries with evidence that link empowerment, gender equality, and nutrition within the agricultural survey. Starting with the objective, our aims was twofold. First, to generate data on empowerment for both women and men, and nutrition for women within agricultural household. Second, to turn the data into action, using it to inform gender responsive and evidence-based agricultural and nutrition policy. At the same time, we wanted to build champions, countries capable of showing that combining empowerment and nutrition metric is both valuable but also feasible. And these champions can become advocates for replication, helping also other countries to adopt and adapt this methodology. So following the timeline below, you can see how we transformed this concept into practice. So in early 2024, we began with the country engagement. We adapted the questionnaire to local contexts and training of field workers to ensure gender sensitive and high quality data collection. By late 2024, we entered the WEN rollout phase in the 3 countries, where full field implementation took place and national team became the first WEN champion. In 2025, we reached the evidence phase, focusing on analysis training, validation of finding, and production of national reports and microdata. This is the moment that data start turning into meaningful story about empowerment and nutrition. Finally, from late 2025 into 2026, we are now about to moving into experience sharing. We have the consolidation of lesson learned, the refinement of the methodology, and the production of learning material to guide future adopters. Also linking to what Jessica said before, in beginning of December, we will have a WEN workshop in Nairobi, where the country who piloted the WEN approach can also share their lesson and their experience. So, regarding the survey methodology, the surveys were implemented as a module within existing agricultural survey. This makes them cost efficient, making sure to keep national representativeness. The interview of the WEN module were conducted concurrently within the one of the agricultural survey. In each, we create a subsample of agricultural survey, and in each subsample, we interview 2 women and 1 man in each household, all aged between 18 and 64. Though for women, we selected 2 different age groups, one younger in reproductive age and one older, to capture empowerment across life stage, but also maintaining nutrition comparability. Interviews were private, confidential, and almost all the time contacted by same genders enumerator to ensure comfort and honesty. This attention to quality and ethics was key to collecting also credible and sensitive data. So what we have learned for this journey. So just to sum up what Jessica said before, empowerment is fundamentally the ability to make strategic life choices that can shape life, work, and well-being, but also to have control over the outcome of these choices. So it's not only about opportunity, but about power and agency, the power to decide and the agency to act on those decisions. Together, these two components show that empowerment is both a process and a condition. It's a process because people gain control over time as they build confidence and access and voice. And it's a measurable condition because we can assess how much influence and autonomy individuals actually have across the domain of their life. So this slide explains how the WEMNS framework translates into empowerment, something often sees an abstract and qualitative concept, but that can be measurable component that we can actually quantify and compare. So each of these domains are assessed through specific indicators that measure how much control a person has across daily domains. The results are summarized in a score between 0 and 1, where 0 means no agency and 1 means full empowerment. Those individuals lacking control in more than 30% of the indicator are considered disempowered. So the scale that you can see at the bottom show this continuum from 0 to 0.3 not empowered. Then we move to partial empowered up to 0.5. Then we have substantial empowerment up to 0.75. And we have high empowerment after 0.75. Finally to 1, which is fully empowered. Now we move to the result that we had in 2 countries, which is Sierra Leone and Liberia. So the 2 countries, women's empowerment score are around 0.46 and 0.47. 93% of the women are disempowerment, and in Sierra Leone are constrained in 59% of the weighted indicators, while in Liberia in 57% of the indicator. For men, we have a higher empowerment score from 0.56 to 0.59. We have that both men, 78% of men are disempowered in both countries, though they are less constrained in the indicators. So in Sierra Leone, we have 57% of constraint indicator, and in Liberia, 52%. So we can position women in the bar between the bar of partial empowerment, while men among the substantial empowerment. But we know that women score around 46 and men around 57, and we have a consistent 10-point gap in empowerment, thus reflecting persistent inequality in agency and access to resources. So what we have done here, we basically run correlation between each indicator and the final empowerment score. And we noticed that despite the 2 countries show a similar empowerment indicator, the empowerment patterns differ across countries. So, for example, for Sierra Leone, autonomy drives women's empowerment. like in Liberia, is more about financial control. So you see, for example, in Sierra Leone, that livelihood autonomy, family autonomy, and health autonomy are the one having the highest correlation with the Women Empowerment Index, while you can see that in Liberia, financial agency is the one having the highest correlation with the women's empowerment. Now, turning into men empowerment. Men empowerment is driven primarily by financial control and leadership, though collective participation remain limited in both countries. So now, moving to dietary diversity for women, we see that in Sierra Leone, 3 in 4 women meet the minimum dietary diversity score for women, meaning that 3 in 4 women eat at least 5 food groups in the previous 24 hours to the data collection. In Liberia, half of them. So on average, women report consuming around 5 food groups per day, which indicate a moderate dietary diversity. These findings highlight both progress and opportunity to further improve access to a wider variety of nutritious food among agricultural households. What we have done also is to link empowerment and nutrition. Basically, we divide the empowerment score into tercile, and we see the level of consumption within the 10 food groups part of the minimum dietary diversity score. And what we have seen is that higher empowerment aligns with greater dietary diversity in both Sierra Leone and Liberia. In Sierra Leone, women with high empowerment report higher consumption of pulses, of meat and vegetable, particularly vitamin A-rich vegetable and fruit, and dark leafy vegetables. In Liberia, empowerment is linked to higher intake of nuts, seeds, and vegetables, though difference across empowerment level are smaller. So what we can say from the linkage between women empowerment and dietary diversity is that empowerment enhances agency over food choice and access to diverse nutritious food, especially animal protein and macronutrient source. But we need to keep in mind that diversification also reflects difference in market access, food environment, and gender norms. Finally, what we have learned is that empowerment is measurable and meaningful. WEMNS has demonstrated that empowerment can be quantified across agency, resources, and achievement, allowing countries to track progress over time. We also have learned that empowerment and nutrition are connected, but also that context matters. Higher empowerment aligns, yes, with greater dietary diversity, especially for animal source and macronutrient-rich food. We also know that data could drive action when turn gender and nutrition evidence into powerful tool for targeted agricultural and social policy. Agricultural survey integration ensure results that are country-owned, scalable, and sustainable. Our way forward is the hope to scale up then to additional 50 by 2030 partner country. We want also to deepen the analysis on how empowerment interacts with important component of agricultural production. We also want to engage with partners to act on the evidence. Thank you so much. Also, if you want more information about that, you can scan the QR code, and you will have our page of the agricultural survey team. Thank you so much.
Thanks so much, Stefania, also for this presentation. And of course, also thank you to Jessica and the other colleague who presented through the video. So we now open up the floor for questions. So the microphones and the cameras are now enabled. You can raise your hand to ask questions. So please don't be shy, raise your hand and ask the question. We can maybe start with some questions from the chat, or I see actually we have Edgin raising their hand, so please come in.
Thank you very much for all the interesting presentations. My question is for Jessica. On the first case, she mentioned the psychometric analysis, and I was wondering how the instrument worked, item response theory analysis. How did they compare across countries? So were the results comparable? If you can highlight a bit more on the results of the psychometric analysis, how this instrument works across countries. Thanks.
Right. So to go into more detail on the psychometric analysis, we didn't use item response theory. We looked at we did factor analysis, and then to specifically look at differences across countries, we do multi-group factor analysis to look at whether the groupings are work well across, like if the groupings of items together to create indicators make sense across the different countries. And we in doing multi-group factor analysis, there are 5 different levels of essentially what we would describe as like standards. We don't meet the highest standards. We don't meet the highest standards on all of the indicators. But among the indicators we tested, we meet sort of middle range standards. And for a metric that, the balance of internal validity and psychometric validity, like the gold standard in psychometric analysis, it often requires you to have a large number of individual questions that are measuring a similar latent construct. That doesn't always balance well with the needs of a large multi-topic survey. If I'm going to hear everything from agricultural production to empowerment to my diet to agricultural profits, etc., I can't spend an hour specifically on women's empowerment. So we're balancing, high quality psychometrics with the practicalities of a multi-topic survey. And so, from that perspective, we feel that sort of like meeting the middle range standards is acceptable for comparability across the 4 countries where we did the psychometric analysis in the pilots. Thank you.
Thanks, Jessica. I might now just take 2 questions basically from the chat, which are totally related. So there's one question by Bridget, another question by Sufiane. I hope I pronounce well the names. So there's a question regarding this MDD for women and how well is seasonality considered during the design phase and during the interpretation. And there was the other question, which is directly related there. How does the indicator account for seasonal variations in calorie requirements, considering that humans may need fewer calories in hot seasons and more in cold seasons? I don't know, Bridget, if you want to add something, please come in.
Yeah, because I was, the question came out quite quickly on the chat, and it's like I couldn't edit it. But I was thinking about the sensitivity of MDD-W over different seasons, and especially in large-scale surveys that may go on for a couple of months. And I wondered if there's any evidence to showing the different sensitivities to seasons by country. you know, we know it's affected by season, and I'm just wondering whether that's really considered, you know, like I think I'm just remembering back to the days of wasting when seasonality wasn't really taken on board properly for quite a while. And then, you know, is this the same? Is going the same happen for MDD-W?
Yeah, so this is a question related actually to the presentation of Kwame, but maybe, I don't know, Stefania or Jessica, if you can comment on that.
Right. I will do my best to comment as a user of some of these metrics. So my understanding of the minimum dietary diversity is that it measures consumption of specific food groups, and we don't have calorie intake from it. So I don't know that that the sensitivity across seasons in terms of calorie intake, if it's able to address that. You know, a lot of these questions are also questions that we would answer with like survey design and survey timing, and not necessarily with the metric itself. So for example, in a study that I have worked on in Burkina Faso, we intentionally have surveys that take place in the in sort of the you know, the lean season as well as the non-lean season period, and then you can do comparisons that, you know, related to the quality of dietary diversity across those two time periods. But I don't think that the MDD is able to address overall calorie consumption. That's my understanding, at least.
Yeah, it's just a yes or no to a list of food. So in the past 24 hours, did you eat, for example, spaghetti? Did you eat, I don't know, watermelon, something like that? And then within each food groups, you have a list of food. And then from within these groups, you can assert if they eat one of these food, part of this food group. And then you will have a final matrix with 1 and 0. And you count for each woman if they eat at least 5. And if they eat at least 5, you give 1, meaning that their diet is more diversified. And you have a maximum of 10 food groups.
Just a question on that. I mean, so I think what's important then, just to get my head around it, is you know, if you've got this list of food groups and you have certain foods that aren't in the season that they're collecting the data, they'd have to make sure that they've captured foods that are both in the lean season and the
exactly.
Thank you.
All right. I'll try to take 2 more questions. We're already at time, but maybe with short answers we manage. So there is a question by Giovanna about whether FAO has women's measurement linked to any interventions on anticipatory action or shock responsive social protection. Please go ahead.
No, I think that this is the first time we are piloting the women's empowerment into a FAO, not even a FAO, a partnership. FAO is taking part. So the Sierra Leone, Liberia, Tanzania are the first 3 countries. We hope that this piloting will enlarge to other countries where we can dive even more to other aspects of the agricultural production or other topics which are very important at the moment.
Okay, and I'll try to take just one more question, and which came actually from the registration form. So there was one question whether you could explain the difference between the women economic empowerment and the women's empowerment in general.
So women's empowerment is something we typically think of as multidimensional. So we can think of that components of it being both economic and related to women's livelihoods and control over income, etc. We also think that there are important components of women's empowerment that are related to women's control over reproductive health, for example, or control over their diets, etc. So women's economic empowerment are, a subset of specific indicators and domains within women's empowerment more broadly.
Okay, thanks. So there's still a couple of questions unanswered, but feel free to reach out to any of the speakers if you still have questions. Maybe I can encourage now just everyone to switch on the camera for a second and maybe the microphones, and then we can give our two speakers and the speaker who has recorded a message a big round of applause. I think that would be nice. Thanks so much, everyone.
Thank you, Jessica and Stefania.
Thanks so much, everyone, for joining. I just want to remind everyone before you leave, I will put on a slide, if I find it, with the QR codes that you can use to join our new LinkedIn group. So we have moved from Yammer with a global network of data officers and statisticians to LinkedIn. So you can scan that code, and please also sign up for our newsletter. This is the other QR code. And yeah, thanks everyone again for joining this time. And please also join our next Global Network webinars coming up. Thank you so much. Bye-bye.
Bye. Thank you.
How do we
access the slides?
Yeah, I'll
Yes,
send
we will post the slide in the LinkedIn group.
Thank you. Bye.
Thanks so
Everyone.
much.
Oh, okay.